I'll have Dr. Alexander-Scott come up and fill in the blanks that I didn't fill in. But thank you so much for being here today, and thank you all for being here.
Thank you, Governor. Good afternoon. Thank you all for being here. Thank you to our colleagues, stakeholders, and leaders throughout the state for partnering with us as well. Very appreciated. As the governor shared, and as most people know, we have seen some very significant increases in our cases over the last several weeks. Our schools are feeling it, our healthcare system is feeling it, our economy is, and our public health infrastructure is feeling it too. These are some of the highest numbers we've seen since the start of the pandemic. However, it is not unexpected, and it's something that we are ready for. The reality is that we have a more contagious variant of COVID-19 now here in Rhode Island. We also have an economy that has everyone back and out and engaging in the economy, in schools, out in stores. That's what we aimed for. With that in place, a contagious variant, and with the colder weather, people moving indoors more, we are going to see case rates, hospitalizations, and hopefully as few as possible, fatalities that will continue to remain elevated into 2022. What's important is to recognize, unlike last year, we can say this year, we have been here before. We have the tools to get through this. We know what works, and we want to implore everyone. It's my responsibility to make sure that you are all educated on what works and how we can get through this together. More than at almost any other point in this pandemic, right now, our health and safety depends on us making use of the tools that we have. I want to share a key distinction as well. Prior to the Delta variant, we have fully been focused on vaccinations. Appropriately so, we have done a strong job as a state in getting as many people vaccinated as possible, using all of the levers we have to do that. What we have begun to learn with the Delta variant, and what we know for sure is the case with Omicron, is that while vaccination is the critical key, vaccination is not going to be the only way that we get through this. We are going to have to layer the first key, which is vaccination, with all of the other mitigation tools that we have, especially masking. Masking is effective, vaccinated as well as unvaccinated, because it works against COVID, the current variants of Delta, the Omicron variant, which is quickly arriving, and other respiratory viruses that we know spread by a similar means. Some of you may not realize, but because masking was required last year, we almost did not even have a flu season. That's unheard of. So masking works, and it is a valuable tool that we have to use during this time to layer with vaccination as we advance our vaccination rate, particularly with the boosters. And I will get into that in a minute as well. The two items that are at the center of the governor's executive order that's we're discussing today are vaccination, which includes getting a booster dose, and masking. We have a lot of real-world local data on the effectiveness of vaccination. Unvaccinated Rhode Islanders are 4 times more likely to be infected with COVID-19 than vaccinated Rhode Islanders. Unvaccinated Rhode Islanders are 11 times more likely to be hospitalized due to COVID-19 than vaccinated Rhode Islanders. This is not a hypothetical analysis. This is our own Rhode Island data that right now 2/3 of our COVID hospitalizations are among unvaccinated individuals, even though unvaccinated individuals actually only make up a small percentage of Rhode Island adults. I mentioned earlier, and the governor has as well, that we are seeing case increases. We are seeing case increases in every age group, but our increases are most pronounced in the age groups where our vaccination rates are the lowest. It's directly correlated. That means our children currently, which have the lowest vaccination rates because of the time taken to get our children 5 and older vaccinated. So please, join with all of us. Be an ambassador if you are watching this. Tell friends, neighbors, loved ones, all parents and families, if there is a child in your life who is 5 or older, please get that child vaccinated. I wish I could take advantage of that now. I have 2.5 more years to go as of now. The differences between vaccinated and unvaccinated people that I'm referencing are based on Rhode Island's experience with the Delta variant, as well as with other earlier variants of COVID-19, and they're based on people completing their primary series of the COVID-19 vaccine. Those first 2 doses for the 2 vaccines or the 1 for Johnson & Johnson. As most people know, over the weekend, we identified our first case of Omicron COVID-19 here in Rhode Island. Again, at the forefront, similar to the very start of this, the fact that we identified this is in thanks to the genomic sequencing program that Dr. Eva King and our team at the RIDOH State Health Laboratories coordinates. Early indications are that Omicron spreads significantly more quickly than other variants. We already knew that about Delta, but what happens with Omicron almost doubles in terms of transmissibility. That means that we can expect to see more and more cases of Omicron pretty quickly over time in terms of it becoming predominant. One thing that we know now about Omicron is that it makes booster doses a necessity. And I want to take a minute to describe that. Prior to Omicron, when we talked about booster doses, we strongly encouraged it for people who were at higher risk, for people who may need to be hospitalized. And the others were okay in terms of their vaccination coverage. Because this is dynamic and because you want a public health team that's going to respond to that and keep you updated with information as we go, it's important to make clear that it has shifted. The booster doses are necessary now for everyone, and it's expanded to be available for those 16 and older. It's because of what we know with Omicron. Early indications are that protection against Omicron occurs significantly better, almost double in terms of vaccination effectiveness when you are fully vaccinated with the booster. If you're just fully vaccinated, early data shows vaccine effectiveness may be 35%. That's with having the 2 doses or the 1 against Omicron. If you're fully vaccinated with a booster, early data shows that the vaccine is to 75% effective against Omicron. So we want to make the update update in our messaging clear. Boosters are no longer just only if you need it or a voluntary effort. They are a necessity to get Rhode Island ready for where we need to be with Omicron. As we've shared, everyone who is 16 and older is now eligible to get a booster dose. So please go get that immediately. I cannot stress this enough, particularly in telling you what we're seeing and what's coming and how we have the tools available to us to face it head on here in Rhode Island. Go get your booster dose today. Please don't wait. Vaccination is predictable. Vaccination with your booster, we know what those outcomes can be. COVID-19 is not predictable. Getting your booster dose now is the new norm. It's no longer just your 2 doses or your 1 dose of Johnson & Johnson. The standard now is getting your booster dose. Please spread that word. We recognize that it is an important and critical update. The data are becoming clearer and clearer, and you know that it's our responsibility to follow the data, follow the science, and have that guide what our policies and recommendations are to you. You need that extra dose of vaccine to get the best protection, particularly for Omicron. It's true today, and it will be that much truer in several weeks when we have more Omicron circulating in Rhode Island and likely predominant in Rhode Island shortly. We have ample supply of vaccine all throughout Rhode Island, and we're working on opening as many new vaccination sites as possible. So spread the word to be ready. We appreciate our municipal partnerships, which the governor referenced, and vaccination sites at the high traffic areas that we're expecting over the next several weeks with our community partners. And thank you to our health equity zones and so many at the community level who are helping to ensure that we're getting to everyone in every zip code. Go to c19vaccine.ri.org to find out where you can go to get vaccinated today. If you need help making an appointment, we're available by phone, English or Spanish. Call us at 844-930-1779. The little card you get when you are vaccinated is proof of your vaccination status. You should have one for the primary series, and you should have one for the booster, a combination. If you've misplaced that card, you can get a copy of your vaccination record at any moment on portal.ri.gov. And very shortly, we will have the 401 Health app available, which, among other things, will make it so much easier to have a verified digital copy of your vaccine record, and if you're a parent, be able to keep that for all the members of your family as well. So we talked about vaccination, and we've recognized that it cannot be the sole way for us to get through this. We are also focusing on masking. Masks work, which is why the governor has announced this new indoor masking requirement. Masks are effective at limiting or preventing the spread of SARS-CoV-2. This requirement is not going to be here forever, but we need it right at this critical moment now so that we can get our booster doses coverage up and adequate to what we need it to be to face Omicron here in Rhode Island. Again, following the data, many studies have confirmed the benefits of masking. They range from small-scale studies looking at transmission in the hospital setting to large national studies. Your mask should fit snugly but comfortably over your nose, your mouth, and your chin. The type of mask you wear matters. A great option is the KN95 mask. Right now, we're pushing out over 50,000 KN95 masks a week into the community, and we're going to be doubling that number per week, given what we expect to see with Omicron. We want to make sure everyone has access to a mask. Wear your mask. If you're heading out, take your mask and wear it. During this refined period of time, let's join together in being able to protect ourselves and our loved ones. The simplest way to think about it is if you're around people you don't live with, wear your mask. Vaccinated or unvaccinated, wear your mask. There are a lot of additional measures that the state is taking to manage our current caseload and get transmission levels down that we've talked about, in addition to the cornerstone, which is vaccination with a booster and wearing your mask. We are also doubling down on testing. We want to get as many rapid home tests out into the community as possible. We want that to be a norm. If you're going somewhere where there are going to be a group of people, get tested. If you're wondering if you have sniffles, take a test before you go into work. Help get your kids used to using the tests regularly. We want them pervasive throughout the community. We're also getting education out in the community about the importance of avoiding crowds and celebrating the holidays safely. We have to continue to stay vigilant together. Treatment is more available now than it has ever been. It's as accessible as possible. We want everyone accessing treatment. And then, similar to what we have been expressing with and to businesses, masking, vaccination, testing, also, we want all organizations and facilities to improve ventilation. Have a focus on that as well. Each one of these tools will make a difference. From your perspective, though, as an ambassador listening to this, ready to carry the word to your loved ones, if there are just two things that you as an individual and your loved ones can do over the next few weeks to keep yourself and your loved ones safe, those two things are get vaccinated with the booster shot and wear your mask.